to share the recording with anybody or revisit anything that's being said tonight, then we'll share that with you later on this week, and that will come through with a link through to the webinar. Just to double check, I hope everybody can hear me okay. If you are having any problems, then again, just do the text chat and we'll be able to assist you. Okay, so we're just going to start. I've just got a few general slides really. Some of you may know a lot about the University of Derby Online Learning, some of you may not be so familiar, but we are part of the University of Derby. We are based in the Midlands in Derby, and the University of Derby was recently awarded a TEF Gold badge, and that's part of the Teaching and Excellence Framework. So it's a really high standard, which is something that we're immensely proud of, and it puts us as a university in the top 20% of all university providers within the UK, so which is fantastic for us, but it's also fantastic for all of our students. So we're one of the UK's leading universities for online learning. We offer vocationally orientated accredited programs, and we also have experienced academic teams who are experts in the subject area. Excellent example tonight is Dr. Pauline Green, who has worked in social care and is being able to bring all of her expertise and knowledge to help to further train people on our courses. And as well as our academic team supporting you throughout your studies, you'll also have a team of non-academic support from our dedicated online learner advisors, and you'll have a named advisor with you throughout the whole of your studies with us, and they will be your primary contact for any kind of non-academic issues or any general queries that you might have. So why choose to study with us? Well, we do provide a structured and supported learning environment with dedicated online tutors, as I've just explained. So although online learning does offer you flexibility in terms of how you manage your study time, it is delivered in a structured period. We operate in a trimester across the year, so we have three intakes, and each module that you would take is generally a 20 credit module, and that 20 credit module would run over a 10-week period, and Pauline will talk a little bit more about that later. So it is a very structured environment, so you do have flexibility in terms of how you manage and plan your study time, but there will be specific deadlines in place to help you get the most out of your studies, and for you to submit some coursework at the end of each module as well. So we have innovative learning, we have interactive classrooms, so using a similar system that we're using tonight in terms of having tutorials. You have access to online discussion forums, different webinars, blogs, emails, Skype, etc. So we try and use as many different forms of technology to help you get the most out of your studies, and also you'll be able to communicate with other students on the course to help you get the most out of those relationships as well. All of your learning materials are available online, so it gives you easy access at any time of the night or day. So if you're studying in Australia, then you will still have access to all of your resources when it's best for you. You'll also have access to extensive e-library facilities with lots of journals, publications, etc. And as I mentioned before, we do have a choice of 3 intakes, which are September, January and May. Again, just giving you more flexibility about when you can start your studies. And at the end of the day, by studying with us, you will achieve a recognised British University Award. Your certificate will say that you've graduated from the University of Derby. So yes, it is a recognised university qualification. So some of the key benefits of online learning that our graduates have told us that has found really helpful is that it gives them that flexibility to fit studies around work and personal commitments, especially if you're in a busy social care working role. Obviously, getting the qualification can enhance your career prospects and your employability. And by studying online, because you're studying and working at the same time, it means that you can apply your knowledge and skills almost instantly, really, within the workplace, which is of a great benefit to you, and also to your employer, and also to your customers, or to your patients, or your clients. You can also develop and make friends around the world. Say, because we are online learning, we have students from all over the world. So again, it helps you to broaden your horizons, and your understanding of other cultures, and the way that other countries may operate. And we'll also have a global alumni for professional links and networking opportunities. And as mentioned before, you do achieve a UK University Award. And when you receive your certificate, it will just say that you have achieved a University of Derby qualification. It won't say on your certificate that you've studied online. That will just appear on your transcript. So that's just a very brief overview, just to give you a bit of context, really, about online learning. But I'm now going to hand over to Pauline, and she will be able to talk you through some information about the different types of programs. And as I said before at the beginning, if you do have any questions while we're talking, please just put them in the text chat, and we'll either answer them, or may save them until the end of the session. But over to you, Pauline.
Share the audio, and should I share the video so that you can see who I am as well? Might be helpful just for a few minutes. So welcome to the session, and it's great to have the opportunity to talk to you about the programs in some more detail. So I'm just going to turn that off, because it does make it easier for you to see the slides and for me to talk through them. So what will you get through listening to this webinar and joining in this webinar session? Well, what I'd like to do is introduce you to the course content, introduce you to myself a little bit more, tell you a little bit more about my background, and also to some of the team members that I work with. And to give you an overview of what you can expect that learning is like when you're online and you're studying, whatever the program is that you decide to study as an online learner. So, right, let me just go on to the next slide. Doesn't want to move. There we go. As I said, my name is Dr. Pauline Green, and I'm the academic lead in social work and social care. I am a Doctor of Education, and I did study here at the University of Derby. I studied my Masters here, and I also studied at doctoral level. And my research that I undertook, and it took 6 years, was in relation to emotional resilience. And so I do put some of that research within the modules that I tutor, and I do talks, conferences, etc. So, I'm really happy to give you that information that I studied over those years. I'm a social worker as well. I'm registered with the Health and Social Care Professions Council, and I actually qualified in 1984. So we'll skip over that one a bit, but just to say that I do have many years of experience working in different fields, from child protection to adoption and fostering, to working as a specialist social worker in hospital as a liver unit transplant social worker, and many other things as well. So I won't go into all of them, but I do, and I am able to share that experience through case studies and practice studies in modules that I tutor. I'm a practice educator. I've been a practice educator for many years, and I'm a very committed, I've got to say. I attend on a regular basis as a member of the British Association of Social Workers, BASWA, and I arrange seminars here at the university, and I do actually record them. So I do a panopto recording of them and make sure that they're available on every program that I'm involved with, so that international students and any of you who are living anywhere else in the UK can't attend the seminar, you can certainly listen to it and see it through a recording that I make. So that's me, but I work with a really lovely team of people who are experts in their own field as well, and they will tutor certain modules because of the specialisms that they have. So my academic manager or line manager there is Paula Shaw on the top left-hand corner. She's very supportive, and I work very closely with Vicky Cockrell, who is in the middle at the top there. She is an academic lead for nursing, and because we're health and social care, Vicky's expertise is invaluable in relation to some of the more health-related subject areas or topics that we cover. Another specialist worker there or academic is Danielle Mills, and she has a background in counselling and working as a CBT counsellor. So again, she shares her knowledge in some of the modules, as does Yasu Katira in the bottom left, and he is academic lead for counselling and CBT. Lucy Hutchinson in the middle there on the bottom comes from education, so she becomes involved in certain areas as well, especially around community learning, and that's her specialism. And Christine Rhodes, who has worked, she's there at the bottom on the right hand side. She has a really interesting background of working in women's refuges, working with substance use. She's also a sex therapist, and she has a really good background, and will share her knowledge with you too if you're studying on the modules. So quite a team of people, good expertise between us, and we have a whole range of health and social care courses. Because of that expertise, we're able to draw on in relation to a whole host of core and optional modules and a selection of different courses at different levels. So if we start at postgraduate level, which we call level 7, you are able to study with us at master's level on an MSc Integrative Health and Social Care programme. That involves core modules around research and advanced integrative practice, but also has many optional modules, and you can choose from things in relation to leadership and management, which is very helpful at master's level, especially in terms of progressing your career, because it may be that you already have a degree and your workplace, your employer, or the career that you're in necessitates you studying further, and actually to get into a leadership or management position, having some postgraduate qualification. So some students will study the full masters, but others will choose to study at postgraduate level a certificate which you would study over 1 year. And as my colleague Lucy has just said, we do work in trimesters, which means that you're able to study a postgraduate certificate. Although it's part-time, you're able to study it in 1 year by taking one module or studying one module per trimester. So there are 3 modules. And so you can do that in partnerships in dementia care as a specialism, or you can do that in leadership and management in health and social care as a specialism. And some students start like that. They start with a postgraduate certificate, but they really enjoy their online learning experience, and they decide to go on and study the masters. And that's quite possible to do. At undergraduate level, we have quite a number of different programs, and just to explain what we have, and I will start, although it's not at the top, I will start at the bottom of that, the Diploma of Higher Education in Health and Social Care. That is a program that's at level 4 and level 5, and it's really good for people, for students who decide that they want to study at higher education level. They may be coming straight from school or college, but also they may have been in practice, or you may have been in practice for many years and have decided that you would like to study at higher education level and maybe ultimately to get a degree. So the diploma at level 4 contains all core modules, and the modules are around things like psychology, sociology, study skills, health policy, understanding physical health conditions. A bit of a mixture there because it is health and social care. So we have tried to balance out the modules to give you those contexts and to look at things from both perspectives. At level 5, we specialise a bit more then in certain areas because we feel that's going to be helpful for you to use in your practice areas. So you will be studying things around safeguarding children, critical issues and safeguarding in adult care, looking in more depth at health policy and social trends, starting to look at research, and again, another kind of staged approach, I suppose, to study skills where we offer you another study skills module, but it's in a little bit more depth, and it gives you more confidence at level 5 to be thinking about maybe studying at degree level. So degree level, level 6, if you get your diploma, you decide you want to continue your study, you will have an automatic place on the BSc at the degree level, at that top-up degree. So you can study that over a period of 2 years. And it may be that you want to specialise in dementia care. That might be an area of work that you're in. And at level 6, we have a University Advanced Diploma in Dementia Care. What you can see there is the Certificate of Credit in Health and Social Care Studies, and it comprises one module. And it's a really good module or a good programme for anybody who's been out of study for some time. It gives you that confidence, that bit of a boost to do a programme and study a module on that programme, to think about then maybe doing a top-up degree and studying maybe at master's level as well. So there are other courses though, and I'm just going to tell you a little bit about them because we also have courses that are very good for your continuing professional development, because it may be that you want to specialise in certain areas, and we have a whole host of CPD modules. Depending on what your area of interest is, we can tell you a bit more about what they are, and you know, we do have quite a wide range of modules. But we have some free courses as well, because we do feel that there are certain subject areas, certain topics that are so current and so relevant that we want to get that material and educate people in a way that's really helpful for them. So we do think about our community, our health and social care community. We think about our service users, our patients and our clients. We also think about people who are caring for others. And so we have some short but free courses which are called MOOCs, and that stands for Massive Open Online Courses. They tend not to be, they're quite massive in terms of how useful they are and the material in them, but they tend to be short, so they're not lengthy courses. And the areas that we have at the moment are child and adolescent mental health. It's a very popular one, as is understanding autism, Asperger's and ADHD. Bridging the Dementia Divide has run several times, and we've had thousands of people studying on that module. And we are creating, and I think it's just about ready, a module or a MOOC which is entitled A Compassionate View of Depression. So, okay, what else can I tell you about the programmes and the courses? Yes, this is useful. This is a slide about reading lists, because when you study online, I think you're probably thinking about, you know, how do I access materials? How do I actually get the materials that I need to study the programme that I'm on? And we make a concerted effort to produce reading lists for you through our library. We have a really dedicated person who works with our online learning programs. Her name is Jill Boland, and she's always willing to offer advice, support. And we create online learning or online reading lists that are e-resources, so that you can access them as e-books and journal articles and websites, policy documents, etc. Everything is available online. And a really good service that's been offered, I think it's probably about 2 years ago now, students have found incredibly useful, is something called Library Plus. So if you go to the library online and you click into the Library Plus button, you can then put in a keyword, and it doesn't matter what it is, but it will bring up lots of journal articles and actually some text as well. So for instance, if it was about dementia, type in the keyword dementia, it will bring up current journal articles that you will find useful for your assignments. The library team also produce and present live sessions for you. So you would, as a student, you would get a list of when those dates are and what those sessions are covering, and students do find them very useful. Each module that you study will have a core and recommended reading list, and it is, those core and recommended reading lists will be, as I say, e-resources. So, what can you expect? I mean, this is students, students will ask me this, what's it going to be like when I first start, learning as an online learner? So what about that first trimester of study and that first module that you study? Well, what you can expect is us recognizing that you're new to online learning, maybe, and us being very supportive of you being in that position and developing your confidence as you go along. So the way that we do that is to offer you regular communication with your tutor. So you will have a personal tutor who will be very interested in your academic progress and profile. And you will have a module tutor that accesses the module 5 times a week. So you're not just sent off with learning materials and, hope for the best, hope you enjoy it. It doesn't work like that. We do actually tutor you online. So your tutor will be entering into discussions, will be commenting on activities that you take part in, and will be offering you 2 to 3 live sessions throughout the module. Each module is 10 weeks long, so you study for 10 weeks and then you hand in your assignment on the 11th week. So probably in about the first or second week, there will be a live Blackboard Collaborate session where you may be taught, but you may be also given some assignment guidance, and you will certainly have the chance to ask questions and to link up with your peers. Around about week 5, 6, there will be another live session, and then towards the end of the module, probably at about week 9, there will be some more assignment guidance. The learning activities, although you don't have to do all of them, we strongly recommend that you do, because they've been created in a way to help you with your final summative assessment, the assessment that is graded. So by doing those activities, they will mean something to you in terms of how you complete that final assessment. And the discussion boards will help you to get to know your peers, get to know your tutors, and you'll start to feel very confident about asking questions that are going to help you, those responses, in terms of what you have to do for your assessment. And formative activities are mentioned there, and that's what I was talking about really in terms of those learning activities. They are formative because they're developing your knowledge in quite a staged way, I suppose, in terms of how your knowledge is developing and you gaining greater knowledge as you go through the module. Okay, yes, you will study with a whole range of students who may be new, they may have studied other things. they may have quite wide and varying practice experience. You know, they may live outside of the UK in other countries, and they bring some fantastic practice experience onto the modules. So for instance, if you're studying something like the public health module, you will be thinking about public health within the UK, but what's going to be very interesting for you is learning about, you know, public health in other countries such as, you know, Zimbabwe or Malta or wherever it might be. And things can be very different, and that's what you learn about, and you can make comparisons about you know, the care that can be offered to people from different countries. So it's very interesting. Yeah, Lucy said this, but I'll say it again because it's very useful for students to know that actually you have 3 entry points. So you can start studying in September, January or May, and that's very helpful for students. How long does it take to study? Well, it does depend on the programme that you're on, and some of our programmes take 12 months, but it may be that you're studying up to a maximum of 4 years. It depends on the programme you're studying on, the level that you're studying on, and actually what your own individual study pace is, because some students like to study an accelerated route of study and will do a couple of modules maybe at one time, but other students like to take it more steadily and will do one module per trimester. So I think I've covered really as much as I can in a session like this, because you're only going to be able to listen to me for so long. But I'm really happy to answer questions now that you may have. And I know you may have been typing in to the session, and I'll have a look at what you've been typing, and I'll be able to answer questions for you. Okay, so I'm just going to have a look at the next slide before we do that, because you have an expectation of us, and you know what you would expect from us as your tutors and personal tutor. But we have an expectation from you, and we've got to be very honest about that. We need you to commit as well, and to commit about 20 hours of study per week, because each module that you study is 200 hours. So you will study your online materials, you'll be doing some reading, you'll be doing some activities, and you will find that that commitment amounts to about 20 hours per week. But you'll have regular engagement to an interaction with your peers and with your academics, and that helps you as you go along. And we are always checking the learning portal just to see, you know, we expect you to check as well any discussions or personal blogs that students have been involved in. But we want you to check as well, because we will be announcing things from time to time that are important. We'll be giving you updates, and we'll be telling you about additional resources. And you will have to put some personal study in. You will have to do some extended reading. And what you'll find is within the modules, module tutors will have suggested what that reading is for each unit. So that does help you in terms of knowing what you should be reading. So it has come to the time for questions, and I'm just wondering if you have been typing as we've been going along, and what your questions are, and we'll try to answer that between us.
That's great. Thanks very much, Pauline. Yeah, we have plenty of time now for questions. We've had a few that have come in on the text chat, but if there is anything else that you would like to ask Pauline or Maureen, if it's related to an application, then yeah, please let us know. But one of the first questions we had was from Sharon. Sharon is a nurse for the past 10 years. She has an NMC PIN number, but she's only got experience in a nursing home for the past 10 years, has wanted to work in hospital, interested in cardiology and oncology. is there anything specific that we can help with, do you think there, Pauline?
Yes. Are you wanting to train as a nurse? Because we don't offer a nursing qualification. We do offer a top-up if you have a nursing qualification already. Oh, you have got, yes, thank you, Sharon, you have got. So are you thinking then that you would like to do the top-up? We do a BSc nursing studies at degree level so that you can get that degree. Is that what you would like to do? Yes. Okay, well, I would recommend then that you enroll on the programme. If you wanted to find out a bit more about the course, certainly go onto our website. But the module lead, the academic lead for that programme, Vicky Cockrell, would be more than happy to engage with you and give you more information. And she could do that via Skype, or she could do that via email, or she would be quite happy to ring you and talk that through a bit more with you.
That's great. Thanks, Pauline. Yeah, Sharon, what we can do is we'll send you some information about nursing. So I think take a look, and it would be helpful to know whether you've got a diploma or an advanced diploma, because then that will determine what modules and how long it will take you. So, but we've got your email address, so we will send you some information, and that will come from Maureen from our inquiries team. So, and Maureen will be happy to speak to you if you've got any general information, general questions. And then, as Pauline said, we can also get Vicky to have a chat to you as well if you wanted a little bit more information there. So, so thanks very much for that question. We've also had a question from Magnus about doing a PhD in integrative health and social care. So, Pauline, would you be able to respond to Magnus about the PhD?
I think it's on here. How do I do that? Yeah. Right, I'm just going to have a look at it on my screen and then I can respond. Okay, Magnus, nice to talk to you this evening. I know you're interested in doing a PhD in integrative health and social care. Unfortunately, we don't do PhDs online. But what I could say to you is that, and recommend really, is that you have a look at the PhD in health and social care that they offer on campus. Now, it is worth you giving the programme leader a call, because it may be that actually, if you do it via a research route, you don't actually have to come into the university very often. Because you will be undertaking research, you will be allocated a supervisor, and that supervisor can be looking at drafts of your work, can be communicating with you via Skype, telephone call, email. So what I would recommend to get a bit more information, Magnus, is that you do have a word with them on campus, because it may work out very well for you. I don't know where you live, but wherever it is, have a word with them and see what they say.
Great. Oh, and Magnus has said he's in Coventry, so not too far away.
Magnus,
so
just to let you know, I'm actually a doctoral supervisor for somebody who is in Coventry, and actually I see her her work on a regular basis, and she communicates with me via Skype at arranged times, and we talk about the research that she's undertaking. So, and just interestingly, and by coincidence, she too lives in Coventry and works in Coventry.
that's great. Thanks, Pauline. So what we can do, Magnus, is we can send over a link to the Derby website, just so you can have a look at the info there, and let us know how you get on. It would be interesting to know if it's something you're able to pursue. We do still have time if anybody else has any other questions that they want to submit. I guess something else that is quite useful for people to know is that if you are looking to want to study, then we do offer payment plans. So if you're thinking about how you're going to finance and pay for the course, then again, there is information on our website. The most popular method that people choose is to pay sort of a pay-as-you-go, really, so that they will start a module, and rather than paying for the whole module up front, you can spread the cost of that module over the 10-week term time. And there are some other options available if you enroll onto all of the modules in that year, and you can pay for those, or then we can offer you a discount. And also, if you pay for the whole course up front, then there is a discount available there as well. So if you're already an alumni, so if you've done an undergraduate course with us, there is an alumni discount as well if you're going on to do any postgraduate studies too. So we don't, unfortunately, offer any scholarships at the moment, but again, if you are a resident in England, you might be eligible for a student loan for an undergraduate degree, and also there are some postgraduate loans available as well. So if you are interested in that, then do let us know and we can send you some specific information, or Maureen can give you a call to discuss that in a bit more detail. But there is some information available on our website that you may be interested to look at. Are there any other questions from anybody? Anything else specifically about social care that you were wanting to know? Then we do have some time. In fact, while you're just maybe thinking about a few questions, we've just got a couple more slides just really to wrap up. In fact, Magnus has come back with another question.
Yeah.
Is the course available on campus?
Yeah.
Oh, yes. So, Pauline.
Yes, Magnus, the course is available on campus. And what you will need to do is, if you have a look at or go onto the University of Derby website, you will see all the details for it. So if you type in a course search, and for health and social care, actually, if you just put that in, it will bring up the whole range of courses that are available. And certainly there is a course there at PhD level, at doctoral level. Oh, there we go. My colleague has given you the link to the web page. And good luck. Good luck with your studies, and I hope you enjoy them.
Thanks, Pauline. So again, just to say, if you are thinking of starting a course with us, our next intake is in January, which feels like a really long way away. So the term starts on Monday, the 29th of January, and the application deadline is the 14th of Jan. So the only thing I would say is that for a lot of the courses, they do we do get really busy. January is a really popular time of year. So if you do want to submit your application now, then we can come back to you to let you know if you've been successful. You don't actually have to pay for the course right now. You only pay for the course once you actually enroll. And enrollment for the course would most likely open sometime early December. But once you enroll onto the course, that's when you would need to choose your modules and to pay for the course. But by submitting your application, you just kind of get all of that administrative side of things out of the way to at least know that you've got a place, because as I say, the courses do get busy, so it's worth it just to secure. Or if you're thinking January is not the right time for you, then our next intake for this academic year would be in May, and again then we would start the system again in September next year. So, and applying, you just go onto our website, click on the apply button. You'd need to create an account, and then you can start to fill in the online application form. And if you're not sure about anything, then you can give us a call, give Maureen a call, and she will happily talk you through any queries that you might have.
Yeah. Hello, Monique. I noticed that you've just joined the session, and this webinar is being recorded, so you'll be able to listen back to it. But is there anything that you would like to ask us whilst we're here? Hi, Joyce. I see that you've typed something there. So you've been on, after the 4-year course in health and social care, what course can I take to get a degree? Can I just ask, are you at diploma level then, or is this something that you're thinking about studying a diploma so that you start at level 4 and then 5? Can you just explain a little bit more about what it is that, and I, you know, what the question is, so I can answer that properly for you. I think what you're saying is that you're asking what course can you take to get a degree. Well, actually, the Diploma of Higher Education in Health and Social Care would be ideal, because that is the first year of a degree, level 4, and then it's the second year of a degree, which is level 5. And by passing and being awarded that Diploma of Higher Education in Health and Social Care, you would then be offered an automatic place on the degree course, so on the BSc Integrative Health and Social Care top-up degree course.
If that answers your question, Joyce, if you need any more info, then let us know. I think it's just understanding if you've already got that qualification, or if that's something you need to do. So, but yeah, if you need any more info, then so again, just to kind of finish up really, while you're still thinking of any other questions, we will be sending out a link, as I've said earlier, to today's session which we've recorded. If you do want any more information about online learning, about any of the courses, payment plans, loans, etc., then please do visit our website. You can give us a call on our number, which again is also in the top right hand corner of the website. And we do, if you've got a general inquiry, then you can email us at UDOL inquiries at derby.ac.uk, and we will respond to you. If you're not already following us on social media, then that's a really useful thing to do. Just keeps you up to date with things that are happening, key dates and information that may be relevant and helpful for you in your while you're sort of thinking about studying with us.
Yeah. Joyce, I'm pleased that we were able to answer your question. You're saying thanks, so I think I got there in the end for you. So good luck if you decide to study with us. And Magnus, I know you're saying about your PhD there. It looks as though you would like to do a PhD in relation to service transformation, which sounds very interesting. When you enrol on any PhD or doctorate at that level of study, you would be deciding what your research area is in, proposal forward, etc. So you would need to talk to the program leader about that and see whether that's something that you could actually research. But yeah, sounds really interesting. So good luck. Oh, Joyce, brilliant. Okay. Well, I will be looking out for you, and I will remember your name and know that you actually took part in this webinar. And so, yes, starting in January, so you'll be starting on a module called Understanding Physical Health Conditions. It's great. It's really interesting. There's some nice activities there for you. I think you'll enjoy it. So welcome. We'll see you in January, or, you know, take part in discussions and activities with you in January.
That's great. Again, just a few more minutes if there are any other questions for Pauline. We will be here for a few more minutes if you would like to ask anything else. But I think that's formally the end of the session. Monique, if you've got any questions, then say we've got the sessions recorded, so we will send that to you so you can look back through. But if there is anything specific that you wanted to know out of this evening's session, then let us know, and as Pauline's here, she can respond to you. But I think that's the end of the session, if you like. As I say, we'll stay here for a bit longer if you do have any specific questions. But otherwise, thanks so much for attending. I hope it's been helpful to you, and we look forward to welcoming you on our course. And we've got a question from Joyce here.
I'm going to say goodbye to you all, except Joyce, I'm just going to, I don't know, probably make you quite happy, hopefully, or reassure you. We don't have any written exams on our courses. We do assess in all sorts of other ways, but it tends to be around developing skills in being able to write an essay, writing a critical essay, writing a business report, and doing presentations, working with others, looking at case studies, so that kind of thing. So yes, hopefully that will reassure you in terms of me saying that there aren't any written exams. And Monique, it's really nice to talk to you. You've got a diploma in social work, okay. And you have a degree in psychology, and you're interested in management and health and social care, so brilliant. What about thinking then about doing a postgraduate certificate in leadership and management in health and social care? That would be something that may be very useful for you in your career. I don't know without talking to you in a bit more detail, but yes, we do offer that a postgraduate certificate. We also offer an MSc, and you can study in integrative health and social care. So you can study leadership and management within that, but you can also go on to study other modules and to do some research as well in a certain area that may link very nicely to where you're working. And Magnus, well done. Looks like you've done really well. So you need to feel very confident about going on to your PhD, because you finished your MSc in healthcare management and it was online study. It was interesting, brilliant. So I'm really pleased to hear that. So I think you'll get on very well at PhD level. Good luck with that. And Monique, yeah, we'll be really pleased to see your name as well and offer you that that postgraduate certificate or MSc, whatever suits you best. It's your second master's. Gosh, you like studying, Magnus. You enjoy it, obviously, but you need to now, if you've got a second master's, you definitely need to be studying at level 8. So you need to do that PhD.
That's great. Thanks very much, everybody. We will stop the recording now and we will